Let me start by just using a couple of statistics to make sure we all recognize the severity and the importance of NCDs going forward. First and foremost, NCDs today in India account for over 50% of deaths. And this number is going to spike, as I will show you and as we will discuss shortly. Second, according to the Harvard School of Public Health, the cost of NCDs between now and 2030 will be a whopping $6.2 trillion. Not billion, but trillion dollars. And just compare that with where our GDP is today. This is more than 3 times our current GDP. And it is not surprising as a result of that our economic growth story is really at risk due to NCDs. So this is really an issue that we all need to take extremely seriously. Let me shift gears and talk a little bit about what is the global picture. And if you see this chart, if you look at the global disease burden of non-communicable diseases, Asia will bear roughly, or will account for roughly 50% of mortality, 50% of morbidity. India is going to be very substantially impacted, as we all know. The India share of mortality is going to be 17% and 24% on the morbidity factor. So India gets disproportionately hit when it comes to non-communicable diseases. This is very much at a high level. If you go one step lower and you look at it by disease, the numbers are actually quite dire and quite staggering. If you look at cardiovascular disease, and I know we all talk about India being a cardiovascular capital, unfortunately, in the world. By 2030, 18 million years of productive life will be lost due to cardiovascular disease in India. That's a shocking number. If you compare that number to what is the loss in China, what is the loss in Russia, in the US and South Africa, we are way off the charts. We are more than all those countries combined. Urbanization is going to further exacerbate the entire issue around non-communicable diseases. We would expect in the next decade about 100 million people shift from rural to urban areas. It's a huge shift that we're going to see that we're all pretty familiar with. We're also very familiar with that the issues of lifestyle diseases, the issues of pollution, stress, increase the primary risk factors. And that is really going to, again, increase the prevalence, the incidence of non-communicable diseases in the big cities. It's stark, as we see, between rural and urban India, how different the NCD prevalence really is. We have a clear opportunity here to address this issue, but we have a very narrow window of making sure that we go back and we look at how do you prevent and how do you address the modifiable risk factors. The good news really is, if you look at what has been published in literature all around the world, and even what the Planning Commission came out with, 75% of stroke, heart, diabetes, and 40% of oncology or cancer can be actually preventable. So there is an opportunity for us. The second big opportunity for us is, if you look at where India is, we are at an extreme nascent stage of the health system and in the development of the health system. So this is the time for us to create something much more sustainable, much more effective to go after and address the NCD issues and the entire healthcare paradigm in India. So what do we really need to do? We need a fundamental rethink where today's focus on the health system in India is really a focus on sickness. And how do we change that paradigm from going from a focus on sickness to a focus really on wellness? This is a huge shift in the mindset, huge shift in the behaviors of individuals that will need to take place for us to be successful. What it really means is we need to focus on prevention rather than treatment. So completely different paradigm change from what we've been traditionally used to doing. The government's focus on public health needs to go up extremely significantly here, and a focus on increasing screening and awareness. And of course, we all recognize that the spend by the government has to also go up quite dramatically given the current levels. There needs to be also a shift from tertiary and secondary care to the early part of the treatment corridor of primary care. I think John talked about this a little bit. Care with protocols, with evidence-based guidelines is another big imperative. And I will show you data in a minute. Adherence, compliance is another significant issue. And we need to think about what are the right enablers. And this is where we will talk about IT and technology to drive up compliance rates to make sure that we get, and people are getting appropriate care and appropriate treatment. There has been a fair amount of success in developed markets of tackling NCDs. So it's worth, as we look ahead in the next 10 to 15 years, it's worth looking back and saying, what are the big learnings that we can get from the developed markets? If you look at chronic heart disease, diabetes, and cancer, the mortality rates have come down quite dramatically. Now, this has not happened overnight. It's happened over a period of time. But there's been a dramatic reduction. So the question really is, what happened and what were the levers people pulled and what can we really learn from? And if you look across the treatment corridor, the biggest insight really is that the most effective levers were those that focused on the bottom on the red, which is the red part, which is on prevention. Not only were they the most effective levers, but they were the levers that gave you the highest return on investment as well. So really this whole shift from focusing and getting us to focus on prevention is really the need of the hour. So let me talk a little bit about, I think you're missing I think we're missing a slide here. What I wanted to share with you also is if you look at diabetes in India, and we try and understand where the issues are and where can one intervene from a technology and IT perspective, what we find is there are 38 million diabetics in urban India. Of that, if you look at the first part of what proportion have got diagnosed, there's a little bit more than 50% have got diagnosed. So there is a massive drop-off when we get to the first part of diagnosis. There is a significant drop-off of those who get treatment. Of those who get diagnosed, less than half actually get treated. And of those who get treated, when you think about and you go back and measure appropriate treatment, are they taking the drugs, are they getting treated in the manner that they were supposed to be getting? That number drops off dramatically. So in diabetes, we would estimate in India, in urban India, the patients getting appropriate treatment out of a 38 million base is about 2 to 3 to 4 million. That is all the number that is. So the question really I would want to use and say is, how does IT and technology intervene at all 3 points in the drop-off points so that we can intervene to improve effectiveness and improve the health system effectiveness? So I think there is a significant opportunity to improve access. And here we'll talk about telemedicine, teleradiology, and other opportunities. There is a huge opportunity to improve treatment effectiveness. And this is where I think IT plays a very significant role, some of the points that John was sharing earlier today. And then I think there is a massive drop-off and a massive opportunity to improve adherence and compliance. Compliance and adherence rates are abysmal in India. And there are terrific examples where IT have actually been very effective globally. How do we bring that into India and improve care? Let me try and bring each one of those to life. You're missing a bunch of your slides are not. So the on access, I think we all recognize. You're missing your. Just give me a second.
Whatever you can, we have uploaded directly like this.
No, you're missing a bunch of slides. Okay, it doesn't matter. So if I talk about access in India, I think that the data is pretty well known. In terms, not only do we have a significantly scarce population, some of the points that Amit was mentioning, and that's both on hard and soft infrastructure. The issue also is the concentration of that infrastructure is really in the top cities. And that is this big issue that we need to solve. So there is a big opportunity to take technology and say, how do we use technology to improve access for us? When we've gone and done studies across 3 different markets, this is interesting data. When we look at Germany, when we look at the US, and we look at India, what was really refreshing for us is that the Indians came out and said there is a higher degree of receptiveness of adopting digital media, social online platforms, of using online doctor and lifestyle counseling services, and then technologies to monitor and manage health. So this is the real big opportunity for us. And in improving access, I think looking at telemedicine services, looking at teleradiology services, doctor on call, eICU, these are all technologies that have been tried and well tested. How do we bring them back to India, and how do we scale this up? There are good lessons to learn from different models. Medicall is in Mexico. They have scaled up rapidly. There are over 1 million people getting this kind of service, with protocols coming from Cleveland Clinic and with tie-ups with the largest telecom operator in Mexico. And in India, clearly there are opportunities here. We're looking at nonprofits like eHealth Points, World Health Partners, and then of course we are seeing the leading hospital chains like Apollo, like Narayana, take on teleservices, but how do we make sure it gets spread and it gets scaled more dramatically? The second point on the drop-off corridor I mentioned was really about improving treatment effectiveness. 4 points to consider here. One is Indianized protocols, Indianized guidelines do not exist. So there is a role IT can play in helping create that. Second, I will talk a little bit about the model of integrated care, and there are some early experiments, with Apollo being among the pioneers. How do we think about scaling that up? And integrated care cannot function without an effective IT system. Third is very low and very poor usage of IT information gathering and information usage when it comes to chronic diseases like diabetes. So how do we improve on that? And I'll show you some data there. And the fourth one really is there is a big breakdown, and the communication between the doctor and the patient can be substantially increased. So what is the role really of technology and IT really in that? If I look across the treatment corridor, and for any chronic disease, the complexity from a patient perspective is quite staggering. You will see multiple stakeholders that the patient will need to interface with. There is the diagnostic companies, there's the pharma companies, the institutions, the device companies, the insurance companies. But then that is what the patient will see coming in. The complexity gets even more compounded because when you see when you have comorbidities in areas like diabetes, there are multiple doctors and multiple caregivers that the patient needs to interface with. One of the biggest issues that we've seen is a lack of coordination and lack of sharing of information across your caregivers. So we think there is a tremendous opportunity here to optimally capture the right information, share the right information, and use the right tools with the caregivers and with the patients to improve outcomes. It is terrific to see that in diabetes we are getting innovative integrated models that are being tried out in India. Apollo being the pioneer with sugar. I see Dr. Hari Prasad at the back. It's one of his brainchild. We've seen other experiments also taking place when it comes to integrated care for diabetes. This is really the need of the hour. And if you go back and look at what has been the success of integrated care models around the world, whether it's CareMore for elderly, whether it's looking at Kaiser in California, or looking at Geisinger when it comes to Pennsylvania, the results of integrated care from a cost perspective, from a satisfaction perspective, have been extremely well documented. But this is all enabled by extremely strong investments in IT and analytics that has helped to create the protocols, and that has been pushed in an integrated manner to help intervene with the patient in a much earlier fashion, to intervene early and then treat in the appropriate manner. In India, as we look at the IT needs, John, this will be interesting as you talked about where the opportunities are. We think there is a tremendous opportunity for us to go out and improve the use of IT. And if I think about segmenting the institution base, if you think about the 52,000 hospitals in India, or the institutions in India, the bulk of it is really in the unorganized segment. So less than 100 beds, less than 75 beds, is about 40,000 institutions. That is really the need of the hour. And if we go and look at what the unmet needs are, it is substantial. Cost effectiveness is one of the top things that come to mind. Integrated, scalable design platforms, the right speccing, So given that there is a big affordability issue and reliable service and support, these are screaming unmet needs when you talk about different segments of the institutional base. So this is the role that IT companies can play in addressing the nursing homes or the smaller or the mid-hospitals. The last one, and I'll just end in 2 minutes, is an opportunity to improve treatment and adherence. There are great examples from Western markets and from China where there has been this linkage between patients sending information on tracking information for the heart diseases, or in China where the patients and the providers actually coordinate to get the right treatment. There's been very successful experiments in Thailand where compliance rates have gone up dramatically with the use of IT and technology. Education is another big opportunity, as we see in South Africa, in terms of what educational materials have been provided on AIDS. Germany is a terrific example on disease management, where compliance rates dramatically went up to 90% in a program that has been rolled out now and scaled over the last 10 years. And Joshua, you'll be happy to hear we have the pharma companies here who have a whole host of applications that are very useful to also leverage. So let me stop here. The 3 points I just really wanted to make really is that NCDs needs to be a top global and a national priority. This is way beyond health. We fundamentally need a paradigm shift to move from sickness to a culture and a mindset of wellness. And I think IT can play a critical role, an enabling role, when it comes to improving access, improving treatment effectiveness, and improving adherence and compliance. Thank you very much.